I'm Dr. Nathaniel Chin, and you're listening to Dementia Matters, a podcast about Alzheimer's disease. Dementia Matters is a production of the Wisconsin Alzheimer's Disease Research Center. Our goal is to educate listeners on the latest news in Alzheimer's disease research and caregiver strategies. Thanks for joining us. Welcome back to Dementia Matters. Each year, the Alzheimer's Association releases their updated Alzheimer's disease facts and figures, a comprehensive report that highlights the impact of Alzheimer's disease and related dementias on over 7 million individuals and nearly 12 million care partners, as well as on the government and healthcare system in the United States. This annual report and its accompanying special report focus on a specific topic of interest in the field, cover the latest trends and perspectives related to prevalence, mortality, caregiving, the dementia care workforce, costs, and more. With all of these insights, what does the field of Alzheimer's and related dementias care and research look like in 2025? Joining us to discuss this year's report is returning guest Dr. Heather Snyder, Senior Vice President of Medical and Scientific Relations at the Alzheimer's Association. Heather, welcome back to Dementia Matters.
No, thanks so much for having me.
I look forward to the annual report every year. It's an incredibly well-researched, well-written document addressing a broad array of topics within the ADRD space. If you could show us, or tell us, I should say, a little bit about its history. What was the impetus for the association in writing this? And what is the process like in producing such a massive document?
Facts and Figures was first developed in 2007, and that was its inaugural release. And the Alzheimer's Association Alzheimer's Disease Facts and Figures report has then continued and grown as really an extensive annual report that explores the burden of Alzheimer's and dementia in the United States. It brings in all of the different statistics that we look at nationally, but also on a state-by-state basis, including the prevalence, the mortality, the morbidity, the range of caregiving issues, dementia care workforce, costs of care. And it's really the basis of so many of the discussions when we talk about the urgency of the research that's happening and the urgency of why the research is so important across the entire spectrum, understanding the underlying disease and the biology that's changing. How can we identify that at an earliest time point, intervene, change that trajectory? And the impact on caregivers, those that are providing the care and support, whether they be a family member or a friend or a neighbor, or they be somebody that's doing this on a professional basis. And all of that is encompassed within this annual report.
I really feel like people from all walks of life would be interested in this document. It covers so much, just like you said, which makes me feel like there must be a ton of work that goes into it and getting it out each year. And so for those that are listening that are a part of that work, I just want to say thank you, because this is really something that is quite helpful. And certainly for people like myself who give a lot of presentations, I'm always citing something from this report.
Yeah, it's an amazing team. So we work with a number of some of the leading experts in the country from all around the country that really understand this data and help to inform both the standing statistics that we update year after year, but also the special reports that are developed each year that focus on very specific topics that are in those emerging needs and trends. And it's essentially the report is published and we immediately start thinking about the next year and the in-depth work that happens by this incredible team of experts from around the country. It's about a 6 to 8 month process.
And we're going to talk about some of the special topic that came out this year. But before we do, because you've been producing this every year, you're able to sort of look at trends too. And so I'm wondering, have there been any surprising trends that have shown up in this report or when comparing data from this year versus prior years?
Yeah, I mean, I think if we look at the trends year over year, the numbers of individuals that are living with Alzheimer's dementia continues to grow this year for the first time, surpassing over 7 million. The report identified 7.2 million Americans living with Alzheimer's dementia, and that's 300,000 more than last year. And similarly, the costs are increasing year over year. This year, we saw the projected costs of caring for those that are affected to be around $384 billion. So that is an increase of about 24 billion from a year ago. I'm not sure that these are surprising because this is what we see year over year as the population that's over the age of 65 grows. We are seeing the numbers grow, the cost of care grows as well. And of course, so does the number of those that are providing care to over 12 million family and friends serving as caregivers in this past year's report.
With a lot of these numbers increasing, like you just said, where do you see the greatest needs in the field?
Yeah, it's a great question, and I think one of the important things to consider is that there is not one specific area, and that's really where research across the board needs to remain a priority. The Alzheimer's Association and the Alzheimer's Impact Movement have been instrumental with our congressional champions at continuing to see major annual funding increases at the NIH. And this year, or today, I guess the annual Alzheimer's and dementia research funding is around 3.8 billion annually. With this, we've seen that progress. I know you live it in a day to day, right? We've been in discussions around some of the work that we're seeing in tools for early and more accurate diagnosis, in understanding that biology in the earliest time points, what's changing in who, and how can we better identify what's causing the cognitive change, the changes in memory, thinking, and reasoning. New treatments that have been approved that are targeting that underlying biology, and an incredibly robust pipeline of what's being tested that's looking at just diverse biology, combination therapies, behavioral interventions, combinations of medication and behaviors. I mean, I can go on and on just about all of the progress. And that progress is directly related to the investments that we've made at the federal level.
So, on a more positive note, then, what trends or findings seem to be improving based on the report? What makes you feel hopeful when you read it?
Yeah, I mean, I think I just alluded to them in with the FDA approvals and treatments that are available for individuals in the earliest stage that may be right for them. That's certainly an advancement that we hadn't seen 5 years ago. And in addition, when we look at the most recent report, there's an annual report that looks at a snapshot of what's in clinical trials for Alzheimer's disease. We see that there's nearly 140 unique therapies that are being tested in clinical trials today. But what for me was most exciting in that particular look and snapshot was the growth in the number of phase one trials. So that means that earliest stage, kind of the first in human trials, there was just a significant increase in the number of phase one trials in this last year compared to a year ago. So that again speaks to that progress as we understand more about the disease. We're translating that into clinical trials.
What are the key findings from this year's report that are worth highlighting?
Yeah, I mentioned before the 7.2 million. So for the first time, we see the number of individuals living with Alzheimer's dementia to exceed 7 million. But we're also seeing the number of deaths due to Alzheimer's increasing. Between 2000 and 2022, we saw that it more than doubled, increasing to 142%, while deaths due to the number one cause of death in the United States, which is heart disease, decreased by 2.1%. And so it really speaks to the progress that can be made with the investment in research, how we can turn the tides, and we can do the same thing for Alzheimer's disease. Some of the other findings from this year's report that I think are particularly important are just the emphasis on care and the importance of care. We know that I know that we've had conversations together about the importance of that, and you see that in your day job, but the cost continues to rise as well. In 2024, of the more than nearly 12 million Americans that were providing care, it was 19 billion hours of unpaid care, which is a 413, I think around 400, just under 415 $1 million like a contribution in that overall aspect, and that's just substantial when we think about the impact that this has. It's not just on the individual, but it's really on that whole unit.
And when you bring up the number of increased deaths, a part of me wonders if that is the field acknowledging Alzheimer's as an underlying cause, the primary cause of death. So often we see death reports, which are filled out by human beings, saying a heart attack or a stroke, but the person had Alzheimer's disease and they were at the end stage and they were actually dying of Alzheimer's. And so often we were feeling like, as at least as a clinician, well, the cause of death is Alzheimer's. The immediate effect was that heart attack. And I do wonder if by addressing stigma, by talking about this disease more openly, clinicians too are now recognizing this and seeing it and actually reporting the actual deaths that are due to Alzheimer's.
It's certainly possible. I mean, I do think that is one of the ideas that's out there about the increased awareness of what actually is happening for an individual with Alzheimer's, in that, in particularly in the later stages. But it's also, I think, an awareness not just on the clinician side, but among the family, and an acknowledgement of the diagnosis or of the lived experience for the individual.
This year, the special report focused on American perspectives on early detection of Alzheimer's disease in the era of treatment. And what did the Alzheimer's Association discover about people's attitudes towards the diagnosis and about these new anti amyloid medications?
Yeah, I mean, you talk to families and individuals all the time. People want information. I think we live in this information age, and this report highlights that Americans want to know early if they have Alzheimer's disease, and they want access to tools and the tests that tell them what's going on with them. Right? They want to know. So when asked, nearly 4 in 5 Americans, around just under 80%, around 79%, would want to know if they had Alzheimer's disease before having symptoms, or before symptoms interfered with their daily life. So, I think it becomes so important for us to think about those tools for early and accurate diagnosis. And more than 9 in 10 Americans would definitely or probably want a simple test, so something like a blood test, if it was available. And the number one reason is that they want to have earlier access to treatment and care. They want to be able to plan for their treatment, plan for their care, and think about those kinds of decision making.
And I do find that in my practice too, that not only do people want this diagnosis, whether it's mild cognitive impairment, dementia, and my own clinical judgment, but they also want that proof, that biological confirmation through some test, ideally a blood test, to confirm that this is what's happening as a platform for the next step. So your report was important. It wasn't surprising to me, but I think it was really important to highlight, just as you said, we're living in a time where people want as much information as possible. And when we provide that in a strategic and mindful way, they really do handle that information quite well.
Well, and you're one audience, right, as a clinician, but there's also families that acknowledge, like, okay, I want to know, and I'm not the only one that wants to know, right? Or our policymakers, it's important for them to know. Our insurance payers, it's important for them to understand. Really, the entire ecosystem having an awareness that this is the environment that we're in, and we need to be thinking about how to prepare. What do we need to have in place for this type of setting, and as we're going forward? And I think, as we look at the trial space, as we look at what's being developed in clinical trials, how do we then translate both that desire of an accurate and early diagnosis to also thinking about treatment, also thinking about what is the patient or the family think in terms of treatments? And the report went into that as well, in looking at that if they're diagnosed, most Americans would also want a way to slow the disease progression, and they would find information about the disease and treatment highly valuable. Now, their decision making may be different, and that's a kind of a separate set of kind of questions and queries, but they want the information. They want access to medications or interventions that can stop or slow.
Were there any surprising findings about what Americans thought about Alzheimer's disease and these treatments?
I think the biggest takeaway, and again, to your point, I'm not sure it's surprising, is that most people want to be proactive in addressing their memory concerns, or their fear of what may be, if they, particularly if they had a family member, and that's true even if it might be Alzheimer's. They want to be proactive, and that's good news, because the best opportunity that we have for care, management, and treatment of the disease is an early and accurate diagnosis, the ability to intervene at that earliest time point. And that's a shift from where we were just a few years ago. And again, I'm sure you're seeing this in your practice, in your conversations with your patients and their families, when there was more of a hesitancy of even bringing it up, right? Even, having a conversation around it. There was that hesitancy within the way patients and communities were even perceived it, and that's changing, and that's a good thing. That as we raise that awareness and as we have those conversations, we are really, I think, highlighting the lived experience of so many and bringing that to the forefront.
I couldn't agree more, Heather. It's refreshing and energizing to see that people are not scared the way they used to be, and they want to be active. They want to do everything they can, which is not just medications, but the lifestyle interventions that I know the association promotes too. And I think it can be really empowering for people to feel like they have something they can do. And so, yeah, this report helped highlight that, and I think it really drove home that information can be power when presented in the right way.
Yeah, well, I mean, one of the things, and you mentioned this, is we have something called the 10 ways to love your brain. So, there's not a single answer today on what we can all do to potentially reduce our risks, but there is a lot of research that tells us that, eating a balanced diet, being physically active, getting a good night's sleep, and, if you smoke, stop or reduce it, right? That there's little things we can all do to have healthier habits, if you will. And that's a way to show our brain a little bit of love.
So, how do you or the association use this report and the information it contains? I mean, do these findings change the way the association proceeds in its mission for the next year or few years?
Well, they certainly inform a lot of activities, a lot of different interested parties. So whether that be the research field, federal and state lawmakers, healthcare providers, clinicians like yourself, different health systems, and we certainly share it broadly and widely, public health professionals, and more, in what their role could be, as really this report itself shines a light, if you will, on the numbers, the burden of Alzheimer's and all other dementia. And it's a help in calling to action all of those interested parties in coming together around these numbers, around the urgency, and around continuing that drumbeat of what we need to do, advancing research, and then translating it into practice as soon as we possibly can.
So, what's on the horizon for the association this year?
Well, as coming up very soon and later in the month of July, the Alzheimer's Association's International Conference will take place in Toronto. We had record number of scientific abstracts that are going to be presented, which is really exciting to see. And again, it speaks to that momentum in the field. It speaks to that momentum that we're seeing in advancing of research in Alzheimer's, but also all other causes of cognitive impairment and dementia. There's been a lot of advances with tools around blood tests, but how do we translate that to practice? And so one of the presentations that we'll see at AIC is the clinical practice guidelines that have been developed with the very necessary methodology that guidelines for clinical practice use. And so we'll see that report for the first time out at AIC. We'll also see, and we just were talking a little bit about behavioral or lifestyle interventions, the U.S. Pointer trial, which is the largest trial of its kind in the United States that really built on science, including, a past study in Finland, and was a 2-year intervention that simultaneously targeted multiple risk factors for cognitive impairment in a population of a little over 2,000 individuals. Over 2 years, is going to report out for the first time. So the top line, this will be the first top line results of U.S. Pointer. So I know field is very anxiously looking forward to this, as of course are we. Regardless of the outcome, it will inform the conversations that we have as a community in thinking about risk reduction and reducing risk of cognitive decline in the community.
And certainly, the results aren't going to change the fact that exercising, a healthy diet, and good sleep are going to help us feel good too, right, Heather?
Well, they're good for your overall health, for sure. I mean, I certainly know. I did during the July 4th, I did a 5K run with my kids, and it was early morning, so maybe we didn't get the sleep we wanted, but it was certainly a fun way to start the day. Great in terms of the family bonding, got our blood pumping and our bodies moving, and it was good for our overall health and our brains as well.
And what's better than that? Well, thank you, Dr. Heather Snyder, for being on Dementia Matters again, and we certainly hope to have you on in the future.
Absolutely. Thanks so much for having me. Have a great rest of your day.
Thank you for listening to Dementia Matters. Follow us on Apple Podcasts, Spotify, or wherever you listen, or tell your smart speaker to play the Dementia Matters podcast. Please rate us on your favorite podcast app. It helps other people find our show and lets us know how we're doing. If you enjoy our show and want to support our work, consider making a gift to the Dementia Matters Fund through the UW Initiative to End Alzheimer's. All donations go toward outreach and production. Donate at the link in the description. Dementia Matters is brought to you by the Wisconsin Alzheimer's Disease Research Center at the University of Wisconsin-Madison. It receives funding from private, university, state, and national sources, including a grant from the National Institutes on Aging for Alzheimer's Disease Research. This episode of Dementia Matters was produced by Kaylin Rowerdink and edited by Eli Gadbury. Our musical jingle is Cases to Rest by Blue Dot Sessions. To learn more about the Wisconsin Alzheimer's Disease Research Center, check out our website at adrc.wisc.edu. That's adrc.wisc.edu. And follow us on Facebook and Twitter. If you have any questions or comments, email us at dementiamatters@medicine.wisc.edu. Thanks for listening.